treatments seem to have a better impact for people. You can go deeper in their healing. And so I wanted to provide something different to the public. When we have a person sitting with us and we're talking with them about, working through their trauma, we might, weave in a little bit of talk therapy and then maybe some EMDR work and then put them on the table and do some energy work. So it could be a wide variety of different modalities that we bring into one session for someone, which makes it us very, very different from any other practice out there. And what we found is when we can weave in all of those different aspects, we get better results with our clients. And they're getting back to their whole self of treating that mind, body, and spirit. We're trying to bring them back to. A lot of people look for that. They're tired of the traditional methods. They're tired of conventional medicine.
The vision that Kim has, it's very forward thinking, very creative and innovative. And it's not in the same model, or I guess I would say box, as many companies are. It's, she provides and promotes a company and an environment where we're all free to help her create the vision.
Is that we look at each person as a whole and not as a set of symptoms. And the services that we offer reflect that, from talk therapy to yoga and dance movement therapy to ketamine and Ayurvedic medicine. So it reflects that we take the person as a whole.
As an individual, you need to have personalized treatment plans and treatment goals. What works for one doesn't work for all. So that's why it's very important to have a personalized approach. And that way you're more invested in your treatment when you can understand that the therapist isn't taking a very generalized approach to your healing.
I've worked for other companies for doing EMDR, and I've trained with other companies, and I've learned a lot with those other companies. I would choose Blue Lotus every day, all day, because Blue Lotus really treats the whole person. I've learned so many things, and even in a short time, every week I'm learning something different, and every day I'm practicing those new things that I've learned with my clients. And I've watched my clients blossom because of it.
And so it's been really nice and refreshing to see people that are more open-minded to a lot of different kind of ways of, approaching the work. So blending some of those more traditional modalities with, these more new aged and out of the box approaches has been really awesome in working here.
I mean, honestly, everybody that works here is kind, and they're here for a reason, very authentically. They really just want to help people. And I think it's really refreshing. Out of the years that I've worked in the healthcare field, people can get burnt out, and people, sometimes don't have the client or the patient's best interest at heart.
About cutting edge, right? I think that is what is integral here, is that you have not only practitioners and clinicians that do the research and really try to stay informed. The approach has to be experiential. It's not just flooding somebody with a bunch of information and all of a sudden your third eye opens and everything's okay.
So one of the things in community mental health, we call it wraparound services. And that's sort of you have a one-stop, place for clients to go to. Being able to recognize where a client has need that maybe I can't, help support them in, but there's someone else here who can. Being able to offer referral in-house is amazing, right? As opposed to having to do an outside referral. So I think the collaboration comes from the idea that if we feel like there's needs that a client has that we're not able to help as an individual person, we can offer them support in other ways with other providers that work here. And that can look like something as simple as a referral for something like medication management.
So if you're experiencing anxiety or depression or chronic pain or anything in your life that is making your functioning difficult, we're here to help. We want to make you whole again.